Well, it's a time where you take out the pen and the paper, something that I talked about earlier when we were beginning here the program this morning with Chris. We talked about catering to your mental health, and one of the things that we said is if you can put yourself in a position and a place of smiling and laughing more often, it kind of can reduce on the mental pressures that you could be experiencing, and as Africans we never want to address them. Welcome to our Tech Note this morning, breaking the stigma about mental health and suicide. My name is Priscilla Regina Nalwaga. Now to just give you a brief about it, mental health concerns and suicide rates continue to rise around the world, but more so in Uganda. In Uganda particularly, you do have mental illness affecting an estimated 10% of the population, and shockingly, suicide is the second leading cause of death for young people aged between 15 and 29 years of age in this country. Here in NTV, we have done stories of young children who have taken their lives simply because they could not comprehend certain decisions that were made around them. So this morning, Stuart Raymond Kasule, who's a suicide prevention expert with Living Works, he has spent some years working to raise awareness about suicide and to provide training to individuals as well as communities on how to recognize the signs of someone at risk and how to intervene effectively. Of course, his expertise is invaluable in helping us understand the scope of the problem and what we can do to prevent suicide. But I'm pretty sure that he did not just jump into the wagon. He has a personal story to share. And so, Stuart Raymond Kasule, you're most welcome to Morning at NTV.
Thank you so much.
I want to first find out, what's your story in relation to mental health and suicide?
The journey to Australia from Uganda at the very early age, at the age of roughly 21, suicide ideation came as a result of the financial stress. When I was in Australia studying at Canberra Institute of Technology, I think people undermine the level of support you need as an international student in a foreign country. Being an African, of course, and also the fact that you have to pay roughly $10,000 every semester. Unless you come from a very well-established family, $10,000 is roughly what, 25 million every semester for a course. So it takes a toll on you, and I guess that's when the realization started coming in. I had to. So
that means that you had to balance your books, but also had to fend for your tuition. That
100%.
means you had to work a lot.
Yeah, 100%. Because Australia has a thing that you're only allowed to work 20 hours a fortnight. So raising $10,000.
Oh, wow, that's tough.
Yeah, it's 100% tough. So you gotta work, but also you have to, you know, pay your tuition. You gotta study to make the deadlines of course units and all the underlying issues. So yeah. So it's, yeah, gets on you a little bit. Okay. Yeah.
How did you try to take your life?
Most times when I was driving, you would let go of the steering wheel, but then you'd think about, I guess, what I would say turning points in your life. People back home, my lovely mother, and I'm like, you know, you gotta hold back the steering wheel. So, and I think people undermine that you need to have a mental illness to literally have suicide ideation. No, sometimes it's just the life stresses, financial stress, relationships that push you to that limit where you feel like hopelessness. And most times what we think in suicide is that the person is at that verge, has passed out the invitations. And probably I did pass out invitations knowingly or unknowingly, that other people did not recognize them around me. And I think that's why I'm driven by self-talk and Living Works Australia, to literally tell people are passing out invitations, please listen, we need this.
Was it a recurring ideation for you?
Yeah, a couple times. Most times when it reached the limit of you had to pay the tuition. Because people who have been studying abroad are well aware that we pay 3 times more than a local student, which means you have to pay the money in time. Because by the time you go apply for the visa to get to be a student, they believe you have the financial capacity.
At what point did you decide to do better with your life?
I did actually information technology networking and after work, of course, doing a lot of jobs around. I was a chef before.
Ooh, nice.
I did chefing with Jamie Oliver. I also worked at Parliament House in Canberra. But then my boss took his life. May his soul rest in peace. He had everything. He owned a restaurant, he owned a travel company, he owned airplanes and flights. He was a pilot himself. Beautiful family. And then wake up and then say he's gone. And you ask yourself, why? But also that brings me back to the conversation when I was in Uganda at school, where we lost roughly 6 students. It started bringing me questions and said, what happened? Because here we associate everything with witchcraft and stuff, witchcraft, bad luck. So that kind of was the turning point in my life. I was like, I need to do something. I need to do better.
Okay.
Yeah.
Looking at the, the most crucial age group in this kind of situation, 15 to 29, that's someone's prime time.
100%.
When they ought to be blossoming in whatever it is that they ought to be blossoming in. But the question is, what are the most common mental health issues that people in that age bracket deal with?
I think people are undermining the level of stress. Stress that comes as a result of family violence, sexual assault. But I also would like to believe that in Uganda, we, in my profession as a behavior support practitioner, in Uganda we mildly diagnose autism, ADHD, bipolar. We kind of just, we don't touch that part a little bit. Yeah, 100%. So we have kids who are struggling on an everyday basis. The expectation on them is high, which leads them to thinking, how can I end my life? How can I stop this kind of feeling? We have had conversations in the community. I've been around the community, traveled a bit. Even yesterday I was in Kachili, and you could hear, as a child as young as 7, 8, I've thought about it, but I cannot tell my parents. So I think that's where we need to talk, start speaking up a little bit.
Okay.
But I think depression is the leading cause of suicide ideation.
Okay.
Yeah.
All right. Societal expectations and measuring up to them. It's definitely a challenge for that age group, 15 to 29. But then how does mental health and suicide coincide? And at what point does this usually happen?
Most people who are very lucky do mindful practices that literally get out of that verge of depression or stresses. But when stresses combine with the health issues, you have a feeling of hopelessness and despair, which leads to, of course, the depression. If it's not diagnosed and it's not treated, the person ends up feeling that burden. I'm a burden to others, which other people want to clarify as a psychosocial disability. But most people don't understand that depression itself is a hidden disability. And globally, according to statistics, 1 in 7 people globally have depression, and that is 13.5 billion people in the world. So how it comes together is when person is depressed, feeling of hopelessness, feels like a burden, and they say, what's my last resort? And I guess if you are aware that World Health Organization released a report, I think last year, we lose roughly more than 700,000 people every year to suicide. That literally shows you we have a loophole. Countries like Australia, New South Wales invest $14 million to suicide prevention alone. In Uganda, we only have 1% towards mental health. Big gap. So 100% mental health, stresses, depression, and also the underlying health issues, anxiety, bipolar, that are not literally diagnosed, push people to that wall.
Well, perhaps the 1% is attributed to the fact that people are not willing to face that as a reality, that someone is mentally unwell or mentally ill. They would rather say than deal with what exactly is triggering this mental state of a person. So that stigma alone could be contributing
100%.
to that figure. And until we acknowledge that, even with so many safe spaces that are coming up, it's very, very hard, and it's almost as private as going to the toilet or
100%.
the bathroom for someone to take a loved one to a safe space to deal with their mental issues. So what are some of those effective ways that we can have promotion of mental health awareness and its education to the communities largely here in Uganda?
I think as a country, first we need data, we need research. During the conversations I've had with leaders, there is no data. They say, oh, we have 5 cases here, we have 3 cases here, we have 5 cases here, we have 3 cases here. There is no consecutive data. We need that data to know exactly what's happening. Age group is mostly affected. Is it the elder? Is it the young people?
Are there particular exams that you can take? You know how there's that IQ test. Are there some tests that you can give to a general public to be able to assess?
So what we believe in suicide, people pass out what they call invitations. Most times we are missing, dismissing, and avoiding. Missing comes up, you may show me a sign. I miss it because I don't know what you're trying to talk about, or what you're trying to show me, or you're trying to present to me. But then there's also dismissing. I see the signs, I know what's exactly happening, but I have also other issues to look at, and even avoiding the same thing. So most of the invitations are very subtle, that we don't recognize them, we do not see that. So collecting data carries lived experience, people who have lived experience. So that's where it's very important, like Australia has the National Board of Suicide Prevention, a whole board of mental health and suicide prevention, which literally calls about lived experience, people who have literally gone through that, who are post-intervention, to have that discussion on the interventions that really need to be happening. So we need that in a country like Uganda.
So let's talk about the risk factors of suicide, especially focusing on Uganda, and how we can aid individuals and families and communities to actually prevent suicide.
Speaking up is one of them, awareness, and also trying to find a word, I'd say, in a local language that means mental health. During conversations that I've had with, of course, Living Works, the CEOs of Living Works and the CEOs of to have with Lifeline International, they ask for data, but also we don't have enough data. We have mild data right there. So if you look at it in the perspective of supporting communities, like I said yesterday, we were in Kasule, we're talking to the LC chairman. We need those small regions, and I think also people also need to understand that they need to use the counsellors at their regional health centres. Counsellors are there probably on their phones, you know, hanging out.
Yeah, I've actually seen it very eminently in series, especially that focus on medical in hospitals and all. Even if a person is going through surgery, they first bring them a counsellor to just walk them through what they're going to experience, because at the end of the day it affects their mental health in one way or another. Yeah,
because I don't think people need to ask themselves, how many times have you gone to the hospital and said, I'm here to check for my mental health?
But here in Uganda, the challenge is that the doctor or the nurse is the counsellor, which does not work.
But also I think like the intention of going to the hospital is mostly people first get really ill, and they expect, if I go to the hospital, I'm going to get some medication or an injection. Counseling, madly. I can give you an example. In Australia, we get 4 psychiatric appointments free of charge, funded by the government. That means you're selling it to the person. If this person goes for 4 episodes or 4 sessions and they feel much better, that means if you say, even if you pay for the 5th one, they're going to be like, oh yeah, I was feeling much better, I'll pay for that service. But the fact right now, if you ask people, I was talking to the executive director of Butabika, if you ask people, what's the Butabika call center number? People have no idea.
Yeah, I mean, just mere mention of it causes someone to go, yeah, so that's the kind of stigma that I was talking about earlier. So let's talk about resources. Are there available resources for individuals who could be struggling, having the suicide ideation or contemplating suicide? Are there any resources that they can get themselves to, and how can they access these resources?
Currently, as a country, Uganda, we don't have models for suicide prevention. We do have community awarenesses, and I've seen quite a couple on Twitter going around. But also I want to think out the box. What about my grandmother in Kotido who doesn't understand, who doesn't even have Twitter?
That's true.
So we need to look at it in churches. Most of our reverends, I was talking to Reverend Nathan is a counselor himself. Uganda Counseling Association, clinical psychologist Kakinda. So these are services that are there. Little, I was talking to him today morning that we need these services. People can literally call these numbers. Butabika, call the center. But also I want to understand that we need a certain level of support, and that's why we're trying to engage Lifeline International, because they're the leading providers of crisis intervention centers. We need more, because if you look at it in the perspective, if you're going to carry the leaflet of Australia to here, we do have like probably 100. That means person can call. We have suicide callback centers, we have mental health, men's support, child's hairline. Here, very mildly, and also there's also big competition.
Very mildly, and when it comes about, it seems to be targeting the elite of society. Yeah, and also one thing I've tried to advocate for is language inclusivity. I think it's very key. I would like to understand that yes, people in Uganda understand English, they know English and stuff, they can literally resonate, but my grandmother, someone who does not, because I was literally talking to one of my uncles and was like, can you put this, you know, training and this, can you translate it in the local language that everybody can understand? All right, so let's talk about the challenges. You talked about the absence of data being one of the challenges, the minimal appreciation of counseling as a complementary to what is offered in health service centers. What other factors or challenges do present themselves for us here in Uganda in dealing with mental health and suicidal in terms of awareness and prevention?
It comes back to, I guess, also the funding, which I've also mentioned about. But also, I think I would like to say, take it on as individuals. I literally altered the course of information technology to be an engineer to mental health. The language we are having with our parents when you're growing up is, I want you to become a doctor, but I want you to become a surgeon. Mental health is, you're not going to make money out of there. So I was literally talking to a clinical psychologist Kakina today morning, and saying as we have like 55 or 53 psychologists, clinical psychologists in the whole country. Doesn't resonate. That means people are not going to be supported.
And that's on the registry.
100%.
It doesn't reflect on them being on ground. One could be in Nairobi, one could be in Australia, as you've spoken. Okay, let's talk about, you talked about counseling. How best can it be incorporated in the broader healthcare system?
I think mental health has, it needs to be recognized as a pandemic at the moment. We have news that was released on 14th May 2022 by New Vision, 14 million Ugandans. Mental. That's sad. Last week we had 3 cases of suicide, people dying by suicide. It's out there. So I feel like it's upon the Ministry of Health definitely to recognize this as a pandemic and create a body where there's going to do a lot of research on exactly what needs to be done. There's research out there. We have been contacting CEN Australia. Research interventions are really there, and we need them to say, this is the help we need. Okay.
Well, Stuart, this conversation is really deep, but in conclusion or summary thereof, there's some individuals who could be facing mental health issues right now. Heck, it could even be the suicide ideation, as you had earlier mentioned of your own struggles and stories. What message do you have to them, and how can they actually access help and support in regards to those two?
To the people struggling, just letting you to know that you're not alone. It's not that you're different. It's okay not to be okay, but it's not okay for you to keep quiet and struggle by yourself. Please seek out help. Counselors are there. Get in contact so you can be helped. We'd rather have you alive rather than take your body to 6 feet under the ground.
Okay, does Living Works have a base here in Uganda?
We will be working with Omuntu Awansi for starters, as because Uganda is going to be a pilot country for the program, and we expand to other parts of Africa.
All right, Raymond Stuart Kasule, having shared his personal story, it goes to show you that you don't have to survive, you can thrive. So change that survival mode and convert it to thrive. You'll be able to make better decisions, take better steps to take care of your mental health, and then thereafter you'll be a good and productive citizen of Uganda. That brings us to the end of our Tech Note. We do return shortly with more conversations. To stay with us.